So this is a really quick video on the organism Actinomyces, or the organisms Actinomyces. I'm really only going to cover one species of Actinomyces, and that's Actinomyces israelii, and then the larger condition Actinomycosis. This is, if you're reading the notes are enough, but if you prefer to learn by video, this is going to go through everything that's in the notes. Okay, so actinomyces in general are what we refer to as a filamentous gram-positive rod. So if you think all the way back to some of your previous courses, we talked about nocardia. Nocardia is also a filamentous gram-positive rod, but there's one major difference. And this is a big buzzword for all you step oneers out there. Actinomyces is an anaerobic, non-spore-forming filamentous gram-positive rod that is not acid-fast. I even have it written down here. I'm writing it twice. This is how you're going to differentiate it from nocardia. So nocardia is acid-fast. There's really only two filamentous gram-positive rods that we talk about. And they're filamentous, and you can see here they kind of look like a knot. And I think some people, when they look at this, they actually think it's like a fungal infection, but it's not. In this case, it's actinomyces. If it was acid-fast and it was a filamentous gram-positive rod, it would be nocardia. So does everybody get that? Acid-fast, filamentous gram-positive rod, nocardia. Not acid-fast, filamentous gram-positive rod, actinomyces. This is your main differentiating feature. Ooh, that was rough. Okay, so what are some other things you need to know about actinomyces? It grows really slowly, like painfully slowly. It grows so slowly in culture that culture is not even really useful for diagnosis. It's really only for confirmation way after the fact. Laboratory diagnosis, therefore, is actually pretty difficult for this. They're slow growing, they're very strict anaerobes, so just our environment is pretty rough. But if you do culture them, you can actually see some pretty cool features, and one of them is their sulfur granule contents, and I'll show you that on the next slide. But what you could do if you decided to try to culture it is you would take the pus from a patient, and the pus would actually kind of be like a yellowish gold color, and then you would culture that, and then that would take up to 2 weeks to show these very thin gram-positive branching rods. It is a colonizing species. It colonizes the upper respiratory tract, gastrointestinal tract, and female genital tracts. And disease actually only occurs when it's introduced somewhere it shouldn't be. So as long as it's in those places, you're fine. But when it moves somewhere it shouldn't be, that's when there's going to be a problem. So when the normal mucosal barriers are disrupted by trauma or surgery or dentistry or other infections, then we have a problem. And there doesn't really seem to be any person-to-person spread. So all of the infections tend to be endogenous. You're giving it to yourself. Okay, so the main thing that we call this, anytime you have an actinomyces syndrome, you actually have what's called actinomycosis. And the most common derivation of this is cervicofacial actinomycosis, aka lumpy jaw. Actually sounds kind of like one of the henchmen for the Joker in Batman or something. But either way, actinomyces causes a lumpy jaw. And it's actually associated with recent dental work, some sort of jaw trauma, or poor oral hygiene. And this is kind of an example of it. You kind of have this abscess here that's filled with this golden pus that you can see here. Basically, actinomycosis is the development of chronic granulomatous lesions that then become suppurative, and they form these abscesses that are connected by sinus tracts. That's another important buzzword, is suppurative abscesses connected by sinus tracts. And these are also called a mycetoma. So the mycetoma consists of tissue swelling, and you can drain the abscess through the sinus tract. And when you drain it, you get to see this beautiful gold sulfuric exudate here. I think the sketchy for this is something like a desert, because doesn't this look kind of like a sparkling sandy beach? And they even have it on like a nice blue background, so now it looks like almost like you're at the ocean or something like that. But basically you're seeing these sandy sulfur granules coming out of the exudate. And these are called sulfur granules due to their yellow-orange hue. Okay, the other two places we see actinomycosis is actually pelvic actinomycosis. This one was popular for a little while. It's actually associated with the placement of intrauterine devices. So what was happening was that, say, a woman would give birth and then she'd ask for an intrauterine device from her doctor to therefore not have to give birth again in the at least near future. And then if the uterus had not all the way kind of gone back to its normal shape or completely healed from the previous delivery, kind of that uterine wall would still be somewhat compromised. And what we were finding was that then the IUD would kind of pierce through it. And it would present initially as this relatively benign form of vaginitis. And then sometimes you could see this extensive tissue damage. And that was actually associated with either tubal or ovarian abscesses or a ureteral obstruction. And that would also lead to this extensive tissue damage. So you could see it in a couple different ways. The other thing that's not that we would see was CNS actinomycosis. This is really not common, but when we see it, you get these solitary brain abscesses. Rarely you'd see meningitis or other manifestations in the brain, but really this one isn't very common. To treat this one, you got a couple options. First, you're going to drain the abscess. Second, this is an anaerobic organism. Anytime we have an anaerobic organism, we want to expose it to the oxygen. So you're going to debride the tissue to expose it to the oxygen. You're going to need to treat this one for a really long time. Why? Remember, it's really slow growing. So you want to make sure you're getting all of the organisms that are taking their time to grow. Penicillin is actually typically the antibiotic of choice, but carbapenems, macrolides, and clindamycin are also effective. And you're, like I said, you're going to do this for a long time, like over the course of months. And that's pretty much it for actinomycosis.